What's up, everyone? Dr. Nate here. Today we're going to talk about bulging discs, what they are, do you need surgery from it, and what you can do about it. So I'm going to minimize my screen here really quick. We're going to make it a little bit smaller. We're going to go here. So as you can see, and we're going to talk about this too. So you see that there's a normal disc here, a degenerative disc here, bulging disc where it's kind of poking out a little bit there. The nucleus pulposus kind of pushes through the annulus a little bit, and then a herniated disc, which looks all red and scary, and then a thinning disc. Now, this is a lot of these are actually normal. So yes, like here's what you look like, probably like early teens, early 20s, and then as time goes on, there's some degeneration that happens. It's just normal. There's some bulging that happens in a lot of people. That's also normal. So honestly, like all three of these, and even thinning, all four of those should say normal. But a bulging disc here is just, as you can see, just the one that is pushing out a little bit. And I have some other videos about herniated discs, so you can check those out. I'm sure that they will pop up at some point in this video. So that's what a bulging disc is, okay? The next question is, do you need surgery for it and do you need imaging for it? So let's first go to the imaging question. We're gonna switch screens here. This is from, and let me move me. This is from the Annals of Internal Medicine, and this is an article from 2011, okay? I'm going to read this real quick because this is really important information to know. Diagnostic imaging is indicated for patients with low back pain only if they have severe progressive neurological deficits or signs or symptoms that suggest a serious or specific underlying condition. In other patients, evidence indicates that routine imaging is not associated with clinically meaningful benefits that can lead to harms. For example, people who get imaging early before the 6-week mark will get surgery more often. It goes on to say that addressing inefficiencies in diagnostic testing could minimize potential harms to patients and have a large effect on use of resources by reducing both direct and downstream costs. In this area, more testing does not equate to better care. Implementing a selective approach to low back imaging as suggested by the American College of Physicians and American Pain Society guideline on low back pain would provide better care to patients, improve outcomes, and reduce costs. Make myself larger. So as you can see, and if you're watching this, you've probably already had an X-ray or an MRI or something like that, or maybe you're considering getting one. But if you don't have those progressive severe neurological deficits, or you haven't had a trauma or some other underlying, like serious underlying causes going on, it's likely not the best thing to go and get that. And for a disc bulge itself, surgery is likely way far down the road and probably not even an option at all. So it's really important to recognize that. Because most people are going to improve with conservative management, which includes physical therapy and other forms of rehab. So that's a huge thing that you need to understand. All right. Next thing, I wanted to go to this next page here. Here we go. So disc healing and its relationship to pain. So first I want to just get my little, I can get my little red pointer here somewhere. Where is it? I think there's a pointer that I can have go. No, anyways. Okay, I can't find it. But if you can see my mouse here, so you'll see that as we age, so disc degeneration and disc bulges. So let's focus on this one down here. So the disc bulges, right? Okay, so as you can see, the older we get, the higher the percentage of people who are going to have a disc bulge. So if you're over 40 or older, 50% of people have some disc bulges, at least from this study. It was a pretty large study too. I think there was over like 2,000 or 3,000 people in it. But these are in, wait for it, populations who have no pain whatsoever. So it's really important to have a really good clinical exam before you start attributing that your symptoms are due to a disc bulge. And even if they are, it doesn't mean that you can't make progress from it, or get past it. Okay, so this is a really important little frame over here. Okay, so what does this tell us about pain and disc pathology? And this is from Jared Hall. He's a great PT, puts out great content. But number one up here, tissue damage does not mean you will have pain or dysfunction. There's very little, if any, correlation between disc appearance on imaging and pain experience. And then even if your pain is related to a disc issue, disc healing is a very real, normal, and common occurrence. Okay, I'm going to read that again. Disc healing is a very real, normal, and common occurrence. So there are ways to improve here, and it's really important to know that. Okay, so what can you do about it, right? You hurt, this information is great. Well, number one, getting back to being as active as possible within reason. So number one, not being afraid of the disc bulge itself. Fear is a big component of it. I'm going to make a whole another video about how to move forward and deal with the pain, because sometimes people don't want to experience any of it, when in reality, we have to go through some of it. Not severe, but we should find things that we can do and exercise strategies and other coping strategies to manage the pain while our body does the rest. Sometimes it takes a longer period of time. I hope that information was useful for you. I have lots of other videos on back pain that go into more in depth into the treatment of different types of back issues, whether it's a herniated disc or stenosis, spondylolisthesis, degenerative disc disease, all that type of stuff. Those will be populated all around the screen at some point. Maybe earlier in the video it was too. If you enjoyed this video and you got a lot out of it, please like and subscribe to my channel. And you can also join my Facebook group that has around 1,300 people at this point of making the video. So if you see this far into the future, it probably has more. But again, hope you got a lot out of this video. I'd love to hear what your thoughts are about hearing that pain does not always equal tissue damage. It's a pretty foreign concept to a lot of people. So I look forward to hearing your comments below. And until next time, I will see you later.